Hello, my name is Amanda Vega. I am a junior at UNCG, majoring in public health, and today I'm going to cover glaucoma. In this PowerPoint, we will discuss what glaucoma is, what causes glaucoma, the symptoms of glaucoma, who is at risk, how glaucoma is diagnosed, how it's treated, and the glaucoma statistics and goals. Let us begin with what is glaucoma. Glaucoma is a disease that affects the vision by damaging the eye's optic nerve. There are several types of glaucoma. Open-angle glaucoma and angle closure glaucoma are the most common types. The difference between the types are dependent on drainage. Now let's take a look at what causes glaucoma. In open-angle glaucoma, the drainage angle, which is the angle formed by the iris and the cornea, remains open, but the trabecular meshwork, which is the tissue responsible for draining the fluid, is partially blocked. This results in intraocular pressure. That's fluid buildup behind the eye. The pressure buildup in this case is slow, but in time may damage the optic nerve. Unlike open-angle glaucoma, angle closure glaucoma is quick and happens from the iris being too close to the drainage angle, causing it to block the angle completely, therefore rapidly increasing the intraocular pressure. Because the fluid buildup can be gradual, especially in the open angle and occasionally in the angle closure glaucoma, symptoms often are not present until it's too late and one goes blind before then. This is also why the disease has earned a nickname of being the silent blinder. However, with rapid increase in pressure behind the eye in acute angle closure glaucoma, one may experience symptoms such as sharp pain behind the eye or forehead, nausea and vomiting, blurred or decreased vision, and sometimes even see halos around the light. Unfortunately, blindness caused by glaucoma is irreversible. Now the question is, who is at risk of developing glaucoma? Everyone is at risk for developing this disease, but there are risk factors that increase the chances of developing glaucoma. Those at high risk include people over the age of 40, people with a family history of glaucoma, people of African, Hispanic, and Asian descent. Asians are especially high for risk for developing angle closure glaucoma. Also, people with underlying conditions like diabetes and hypertension, or just bad vision, as in farsighted or nearsighted, can also be high risk in developing glaucoma. How is it that we can diagnose this disease? The standard eye exams, such as the visual acuity test, which measures the sight at several distances, and the visual field test, which measures peripheral vision, may help to diagnose glaucoma. Another common test to diagnose glaucoma is the dilated eye exam. This is where drops are placed inside the eye to dilate the pupil. Then a distinct magnifying lens is used to examine the retina and optic nerve for signs of damage. In what ways are we able to treat glaucoma? Unfortunately, as mentioned above, vision damages by glaucoma is irreversible. With that said, there is no cure. We are, however, able to manage it. If we detect it in early stages, we may be able to prevent further damage and save the remaining vision. Medications usually consist of prescription eye drops that help reduce fluid production of the eye. Oral medications as well may be used for the same purpose. Laser trabeculoplasty is when a laser is used to open the clogged canals in the trabecular meshwork. Sometimes conventional surgery may be required to create a new passage to release the fluid buildup. According to the data of population-based surveys, 1 out of every 40 adults, age 40 and above, have glaucoma accompanied by the loss of vision. That means that there's an estimated 60 million around the world affected by glaucoma. Out of the estimated 3 million Americans, only 1.5 million of those are aware of this condition. Here at home in North Carolina, we have more than 87,000 people affected by glaucoma. With cataracts being the first cause of blindness, glaucoma comes in at a second. Healthy People 2020 aim to improve overall vision health and prevent, screen, and treat conditions such as glaucoma in a timely manner. There are several foundations that are trying to raise awareness in hopes that more people will go and get screened and prevent blindness. The Glaucoma Foundation not only promotes awareness but also raises money for research and is attempting to find new treatments for cures. Now I would like to summarize some of the information that we've discussed. Glaucoma is a disease that affects the optic nerves. Everyone is at risk, some more than others. Glaucoma is manageable but not curable, and the damage that's already done is irreversible. Medication, laser therapy, and surgery may help relieve symptoms and prevent further damage. Healthy People 2020 suggests that we need to promote awareness and promote those to go get their regular screenings for their eye health to prevent blindness from occurring.